things like that to try to cut out that gallbladder. And whenever they got it out, I actually got to hold it, which is really cool. And then they cut out the stone that was in it that was giving them problems, and I got to hold that too. The hernia repair, I have a picture of the hernia, what that is, on my slide. And that was actually the guy that came up fighting afterwards. He's like 20-year-old. He's really buff, and he was like a really nice dude, but he came up fighting. Exploratory surgery. Somebody who had had multiple surgeries. They were having like it turned out they were having leakage in their stomach, and so they just went in there and put a bunch of like a mesh and gauze in there, and they left it actually, and they just sewed it up, and then they apparently they went back in a few days later and fixed it. A nerve blocker, which is where they stick a big needle in the top of the thigh, the femoral artery, and they actually like put a liquid in there that completely stopped that whole nerve, so they couldn't feel anything in the leg. And then I almost got to watch a C-section at the end of the day, but at the last second, the baby ended up turning around and not be breech anymore, and so I didn't get to see that, which would have been really cool in my opinion. So what I gained, some of the pros are social interaction. He got to talk with his coworkers a lot. It was very laid back. I was very surprised about that. And since he knew he was having to explain everything to me, obviously, but he knew what he was doing, and it was pretty easy to him. He got to sit down and just monitor those vitals and take notes the whole time, and it seemed like he knew, like he was pretty used to it. He didn't do much of the surgical work, which I don't think I would want to be, really actually doing the dirty work, which is a good thing. And he gets pretty good hours. He works like 10-hour shifts every day, but he works only like 4 days a week. And then 1 week out of the month, I think he said he's on call. Some cons, the intubation. I don't know. Something I think I could do it once I got used to it, but something about the throat, it really bothers me. And it could be, and it got boring at times. And he didn't even get a break. And tell in between surgeries when he had to eat. So my first interview with Nicole Hayes. I actually know her. Her son plays on my brother's baseball team. Um, and so some of the notable things that I said was her daily duties. As a critical care nurse, her daily duties involve getting there, assessing every patient. She said she had to check them from head to toe, which is very time consuming. She said, and it was, it's a very demanding part of the job, but she has to do that for every patient before she even begins to treat. Her motivation, she said it was the best thing in the world to have somebody come back that was paralyzed whenever you had them, and then you treated them and they come back walking and give you a hug or something. She said it's the best feeling in the world, and there's no way to describe that. Scheduling, she said she gets scheduled like 3 weeks in advance and she has to pick her own schedule, and she said that's actually really stressful, and she messes up sometimes, but they're also very good about trading shifts. My second job shadow was technically Keisha Pam, but I ended up job shadowing a few guys most of the day. A few other guys in the hospital, but they were RNs and LPNs and nurse practitioners. So when they're not seeing patients, I mean, it says they do all these things, but honestly, while I was there, a lot of the time they're just kind of doing nothing, doing schoolwork, getting continued education hours, whatever it may be. Sometimes they call patients, they had to call this one patient who told me he had chlamydia, and he ended up coming up there, and it was kind of funny, honestly. Whenever they see patients, they will be like basically a typical clinical setting. They evaluate them, diagnose them. If they need to treat them, they do. If they need to take urine samples or whatever, they do. What I got to see a kidney issue. So basically, a lady came in and said she was having problems with her kidneys, and all they did was took a urine sample from her and I analyzed it, and they would get back to her in a couple of days. Some old, like 70-something-year-old man took a sawzall all three of his fingers a few days earlier, and I don't know how he got through three fingers, but he did. And so he came in and they had to rewrap that. And then I got to see them stitch up a finger. And if you look on my slide, or some lady cut herself in the oven. And if you look on my slide, the top one is simple stitching, and that's actually what they did to her, where you have each individual stitch is like a single piece of string, and that is the best way for like small cuts on the fingers. And then on the bottom, I forget the name of it, but it's where it's basically one long piece of thread, and it looks smoother, but it actually, if one of those comes out, they all come out, and it's messy. Yeah, that was actually something new I learned. What I gained. A small clinical job is extremely different from hospital. Hospital, he was on his feet all day. He was moving. He was doing surgeries. Clinical job, he wasn't doing much all day, honestly, and You had plenty of breaks and plenty of time to do schoolwork. So it's a great job if you're during school. And then a lot of patience, obviously, if you're doing that. And that was the biggest thing. I learned how to give sutures, stitches, which is it was really cool actually to me. My second interview was Summer Masters. She is a nurse practitioner in Kansas City at Cano. Her scheduling was actually quite different. She said she had scheduled like 2 to 3 months in advance, and she has to pick her own. And she said it's a blessing and a curse because she knows what days she's gonna have off to plan, but at the same time she doesn't know what days to ask off for because she hasn't made plans that far in advance. And they must work like 1 weekend a month, I think it said. So it's not like you can just choose all weekdays every day. Professional advice. She told me that I needed to go through a nursing degree, and then she really advised me to go and choose the field that I really did love, because whether it be nursing or not, because she said it's not as much money as you think. You shouldn't do it for the money, and if you don't love the medical field, then it's not something that you're going to want to do because there's patients that are ungrateful and there's patients that are rude, and it's not always the most gratifying job ever. In her free time, well, she actually works 2 jobs, so she doesn't get much. But I thought it was great that she has the ability to work 2 jobs, so that obviously means she would get quite a bit of free time if she was just that nurse. And I thought that was really good considering the lifestyle I want to live. My overall takeaway, the nursing field does have a lot to offer, and I was impressed by the hospital job, and I was very enlightened. There was a lot. It was one of the most interesting things I've ever done, honestly. And I really enjoyed going there and seeing all those things. It was a great experience. And I am glad that I went because you don't really know what you're doing until you get in there and do it. And getting in there and getting to see those surgeries and see the things I like and I don't like about the field, it makes me feel better because it makes me feel like I have a better education on what I actually want to do when I grow up. And one thing I was worried about before the interview or the job shadow was surgery and blood and everything because I hadn't really witnessed very many surgeries. I watched a cadaver once, and that didn't bother me, but I was worried that I would, get woozy or lightheaded. And I'm really glad because I handled it all well. I saw some pretty gruesome things. I held a gallbladder, and I handled it well, and I didn't get woozy at all. I thought it was very cool, actually. There's a lot more to love about the medical field than the pay. I loved the whole environment. It was a very lax environment. My job shadows a lot more than I thought. I thought like the medical field would be very professional and uptight, but I mean it was very lax. Like people were talking and joking constantly, and they were teasing each other, and it was just a great environment, honestly. And seeing patients all day and being friendly and just having that chance to build relationships with people was great. And so that's my presentation.